Hi, this is Dr. D. Grace with the Cancer Detox, and today we're going to talk about Black women and breast cancer. Well, we all know that Black women are more susceptible to dying from breast cancer, more susceptible to actually getting diagnosed with a more aggressive forms of breast cancer upon initial diagnosis. So what is going on? Well, here at the Cancer Detox, we're all about identifying compelling research and information that will not only help you prevent cancer, but also help you overcome some of the issues you may have if you're dealing with a breast cancer diagnosis. So, breast cancer right now is one of the leading causes of death in women in North America. In fact, there's about 2 million women who are diagnosed with breast cancer annually, just on this continent. Black women make up a higher proportion of some of the more aggressive breast cancers, such as inflammatory breast cancer and triple-negative breast cancer. That's where there's not really a hormonal link to the breast cancer. However, there seems to be some issues maybe with some genes that have not been identified. Well, what we do know and what scientists have uncovered is that only 5 to 10% of breast cancer cases are caused by bad genes, quote unquote. These may be genetic mutations in genes that help to prevent breast cancer, such as what's known as BRCA1 and BRCA2. Well, if only 5 to 10% of breast cancer cases are caused by these bad genes, what's causing all the other cases of breast cancer? Well, that question kind of leads us to let's looking at some of the research. And what we do know is that early age administration, some lifestyle choices that may not be the best, such as lack of exercise, eating diets that might be high in processed foods, such as chips and cookies and pies, and also trans fatty acids, which some people may get from fried foods, fried meats, as well as processed meats, such as sausages and hot dogs. All of these things have been implicated in increasing the risk of not only breast cancer, but other types of cancers as well. So, Black women, how do we protect ourselves from this aggressive triple-negative breast cancer? Well, luckily, there's been some compelling scientific studies that have come out on this particular topic. Because guess what? The healthcare community knows that we're suffering from breast cancer at higher proportions than our compatriots. Let's start off with cruciferous vegetables. And I know you hear the word vegetable and you just want to go run and probably scream. But the good news is that a lot of these vegetables we're already eating, and they are called the cruciferous vegetables. They're important because there are literally thousands and thousands of scientific studies that have shown that they increase cell death in cancer cells, that they stop metastasis. That's where the cancer spreads to other parts of the body. And the good news is that they have an inhibitory effect on the growth and development of triple-negative breast cancer. There is a study that was started back in 1995 called the Black Women's Health Study. And they have almost 60,000 Black women in the US, and they're asking them every couple of years about their overall health as well as their dietary intake. Well, in this study, they found that women who ate more cruciferous vegetables had a lower risk of aggressive triple-negative breast cancer. One serving of vegetables a day lowered the risk of breast cancer by 21%. That's great news, right? Now, if you were to eat at least 2 vegetables a day, 2 servings of vegetables a day, now think about that. That could just easily be vegetables in the morning in your morning smoothie, as well as a vegetable for lunch and dinner. Well, that lowered the risk of aggressive triple-negative breast cancer by 43%. Now, specific vegetables, like I said, these are things that we may already be eating in our diet, such as broccoli. 3 servings of broccoli a week in this particular Black Women's Health study was shown to reduce the risk of breast cancer by 13%. And if you ate collard greens at least 3 times a week, that reduced the risk of breast cancer by 19%. Now, honorable mention does go to spinach, which is not a cruciferous vegetable. However, it has its own cancer-fighting benefits. In this particular study, when the women said they ate spinach multiple times per week, they saw a reduction in aggressive triple-negative breast cancer by 22%. Now, this particular study is published, is out there in the scientific literature, so you can look it up yourself and read it, but I definitely do think this was compelling enough evidence to share with you, at least to say all is not lost. And the good news is that a lot of studies are now showing that women who are already diagnosed with breast cancer, whether it is one that is receptive to hormone treatment or more aggressive breast cancer such as triple negative breast cancer, they benefit from eating lots of vegetables during their breast cancer journey. So definitely do not give up. There are ways to prevent breast cancer. It is definitely not something that is meant to run rampant in our community. Black women, you have the power and the choice to make some of these important lifestyle changes. So hopefully this information is compelling to you. Again, this is Dr. D. Grace with The Cancer Detox, thecancerdetox.com, on Instagram at The Cancer Detox, and on YouTube at The Cancer Detox.